One of the most challenging places I worked at as a clinical psychologist was at a youth justice centre. So basically, this was kind of a baby prison where people who had been accused of a crime or an alleged crime and they were under the age of 18 got held in remand. So they sort of got held until their trial day or until the court figured out what was going on. Now, these kids were young, they were between the ages of 12 and 18. Now, my job at the time, I was actually on placement as a clinical psychology registrar. I was already a psychologist, but I was doing my clinical endorsement. My job was to run psychosocial programs for these young kids. So maybe they were involved in petty theft or some disorderly conduct, and I ran these psychosocial programs that aimed to just give psychoeducation around drug use, around social relationships. It was very surface level stuff. As soon as you go into the prison, you need to be strapped up. You're sort of wearing a belt that has keys, that has your walkie-talkie. You're not allowed to take phones in. You're not allowed to take a bag in. You're not allowed to take nothing with you. You kind of go down to this room and there is that one old phone that can page one number if there's someone who you need to call for help. Now, a lot of the time they didn't actually turn up to their sessions, but if they turned up, they did get brownie points when they did go to trial or did see the judge if they had participated in these psychosocial programs. One thing I always wondered was that these kids needed so much more than basic psychoeducation. But the reason that they didn't really offer it in the prison was because you can't exactly do trauma therapy on these young people and then put them back into this environment. The next really sad thing I learned was that a lot of them would reoffend because being in this environment gave them structure, it gave them a roof over their head, they were away from abuse from their parents or their families if that was the case, and they were fed 3 meals a day. So for some of them, this was a better life in there than in the outside world, which was unpredictable, it could have been filled with violence, and it could have been abusive. Final thing I learned was that there was a lot of undiagnosed ADHD for lots of young people who were impulsive, who were reckless. They had either had parents who were alcoholics or they just grew up in an environment that didn't support their mental health needs, and a lot of ADHD went undiagnosed. If you enjoy these stories and you want to know more, comment below.